Had lots of fatigue. I hurt everywhere. I'd been into doctors to see what could possibly be wrong, and nobody could diagnose me.
So Lyme disease, it's one of the most controversial illnesses in the history of medicine. It's the fastest growing infectious disease, and it's quickly sweeping the country as more people are starting to understand it, understand the symptoms, the exposure, and the risk factors.
From the beginning, the first symptoms I noticed was a racing heart, shortness of breath, and from there it went to left side numbness and slowness of my hand. I'm a piano teacher, and I noticed that I was really slowing down in my playing. Here I was last Monday, and was telling Dr. West all of my symptoms, and all this, I went in thinking, I went in skeptical, and I thought, you know, I'm not going to say anything about the cyst. I'm going to see if this guy can figure me out. The numbness on my left hand and my leg. I played in church. I haven't played in church for 5-6 months. I stopped, and I'm a piano teacher, and that's what I love to do. Very skeptical. What can vitamins and a little tweaking do? You know, these symptoms were real, and in my head, I was going downhill fast. I mean, I didn't know what I had, but I knew something was happening. And for him to tweak and just relieve that was amazing.
You can have every Lyme symptom in the book, fatigue, brain fog, joint pain, and still be told you're fine, but still sick. And if your Lyme test came back negative, you can have the Lyme symptoms, over 40 main symptoms. And your doctor maybe still be telling you, hey, it's fine, it's all in your head, quit looking on the internet. And that's because the standard Lyme tests your doctor uses were designed decades ago to detect acute infections and not the chronic or relapsing ones that people struggle with today. How long have you been sick?
As long as I can really remember.
Okay,
honestly. So 20 years.
Some infectious disease, tick-borne illness involvement. You did a whole bunch of stuff in healthcare.
He had been sick for, as he said, probably 20 years of his life, and we were at a place where he needed help. It was the end.
So we did a really high dose vitamin C infusions, dilute hydrogen peroxide, dilute hydrochloric acid, ultraviolet blood irradiation therapy, amino acid therapy.
Neural therapy.
So that's how we reboot nerves. It's a way to get the nerves to open, close, and reset.
Acupuncture as well.
Okay, so again, just trying to line up your energies. We gave you some supplements. Yeah, so when you load up the body with building blocks, I like to tell people it's kind of like there's a crew, a construction crew waiting for the lumbar truck to come up to be able to, you know, have a bunch of, to build a new house.
I all of a sudden just saw, it was like a light switch almost. He would come in the morning, and I was almost like, who are you? And emotionally, he was in a better place, and I could tell physically, definitely he was in a better place.
Let me ask you something. Have you ever been told your labs look normal, but you still feel awful? You're tired all the time, you're inflamed, your brain is foggy, maybe your body just keeps feeling off, and you keep hearing, everything looks fine. If that's you, I want you to know this. You're not crazy, and you're not imagining.
It took me over a year to get diagnosed. And so the first thing they were saying, it was fibromyalgia. Well, possibly it might be an autoimmune disease. When all of that basically came back negative, my physician that, you know, I'm currently seeing basically said, oh man, I hope it's not Lyme disease, because if it is, there's nothing I can do for you because you're in the chronic stages, according to guidelines.
You came here how long ago?
Over a year ago now, I think.
Okay, so it's about a year. And from the time that you started to now, you marked on your paperwork that you were a percentage better. What was it?
Today,
Yeah.
65%.
Okay,
better.
so, and then what does that allow you to do? Because I know it's not 100%. You still have work to do.
We still
but
got work to do.
What can you do now?
So I'm able to cook my own meals. So I'm able to cut up vegetables now. I started physical therapy, so I can walk back and forth in a pool, which would have been absolutely impossible a year ago. And I only have to sleep 2 hours a day as opposed to basically all day. What I want people to realize about Lyme disease is it is very prevalent and it's hard to diagnose. And a lot of doctors just don't recognize it. There isn't the knowledge base and understanding out there. So keep searching for answers and keep pushing for better testing and patient and physician education.
All right, you guys. So we just wanted to double check on sound, and we're rolling. So here we go. This is about people that are medically unheard. And I hear this all the time. Matter of fact, I heard it twice today. And here's what happens. It's, 2 o'clock in the morning, and you're staring at your phone and you're scrolling through PubMed articles. You're watching another YouTube video and you're joining a Facebook group, or you're trying to figure out what is happening to your body. And this is so common for people to literally, it happens all the time. And people are told, hey, your tests are normal, that you don't have anything. And people say, I go and I talk to my doctor and I tell the doctor, hey, I found this, and I get some dismissed, or I get gaslit. And it's so fascinating to me what is happening to people, because they come in literally with a folder full of lab results. They have screenshots of protocols. They list symptoms that seem to change every day. And despite all of the data that you've been through, what happens is the doctors are saying, hey, it doesn't work. So, or I'm the doctor, let me drive the bus. So what I'm talking about here, you guys, is I want to give a YouTube live for the people that feel unheard. And they're the cautious skeptic, where they're literally saying, doctor, you have a full-time researcher on your team, and that researcher is me, and the doctor isn't listening to them. So this presentation is literally for that person. It's for the person that is saying, look, I'm engaged and I want to be a part of this. And what I found is that patients really don't want heroes anymore. They don't want doctors anymore. What they really want is they want to know, hey, if I have a question for someone, I really want someone to listen to me and go through it. That's what I've committed to do. And so this presentation is for that person of saying, look, if you're tired of not being listened to, or you're tired of being dismissed. I had one doctor tell a patient, listen, if you're going to do the medical protocol, you don't need to do anything else. And the patient was like, wait a minute, what about my diet? Does that have anything to do with my outcomes? Oh no, it doesn't have anything to do with that. Well, what about my, thoughts? Well, maybe there's a little bit of data on positive mental attitude. And the patient was like, look, this is not the doctor for me. So what I wanted to talk about is for those people that are medical researchers. It's the tiger mama, or it's the courageous father that's either for their spouse or their parents or for their kids. And they're saying, okay, what can I do to have a better outcome? So let's talk about some ideas of how to do that. So first of all, number one, the trying to figuring out what's happening to your body. And again, those folder full of lab results, the screenshots of protocols, the list of symptoms that change day by day, that is gold data. And what I tell people is I love it when people bring these in, because this is what happens when someone is like, I need a viewpoint, we need to do an intervention, and let's do a test to see how we're doing. And that's exactly how medicine should be practiced. And I wish if I could wave a magic wand and I could tell doctors, hey, listen, you know what? My dad taught me this lesson that you learn a lot of things in your undergrad, in your grad, in your residency, in your internship, in your program. And guess what? You learn even more from the person that has the disease. So this is for the medically unheard, is don't give up. And you keep going and you keep looking for someone that wants to partner with you and not be your hero. They want to be your guide. That's my goal, is I want to be people's guide to help them. So if they're up in the middle of the night, they're looking at things. A lot of times I've heard it 26 years in, people say, guess what? Have you heard about European mistletoe? Have you heard about curcumin? Have you been asked about coral calcium or Himalayan salt or sea salt? Or have you been asked about niacin or NAD or methylene blue, or phosphatidylcholine, phosphatidylserine? What about this surgery? What about this chemotherapy? What about this medicine? Are you aware of these side effects? Like, this is what you get asked all the time. And here is the beauty about that. If doctors get their egos out of the way and say, look, give me the data and I'll help work your way through it. You're the player, you're the all-star player. I'm the coach on the sideline. If we put our heads together, guess what? We can win. It's not all about symptoms. It's about how to get balanced. Your body isn't blocked. Excuse me, it's not broken, it's blocked. I said that backwards. Here's what happens is we've got to figure out, all right, what is the block? Is it emotional trauma? Is it physical trauma? Is it a missing vitamin? Is it a missing essential fatty acid? Is it a poison? Is it a sleep environment? Is it mold? Is it heavy metals? Is it a side effect of one of the medications? And I fully believe that doctors give medications without wanting any side effects, but there's no such thing as side effects. Like if there's one thing I classify, drugs have effects, vitamins have effects, minerals have effects, herbs have effects. When we say side effects, we literally are saying, oh, this accidentally happens. And that's not what happens. They're only effects. So what is the blockage? And then when I believe that the body, when it's improved, when we remove those blocks, people get enormously better. That's when we get their lives back. It's not just me saying it. You can check everything out literally on our website. You can go right here, West Clinic Online. Up here on the corner, up there, there is a success blog. And it's not just me saying it. It's people that have literally, that are out of hope and out of time and out of options. And so if someone isn't listening to you, I would urge you, keep searching. I've met amazing doctors all over the world, all over the United States, all over Canada, all over Mexico that are trying to get out of the system, which is a 5-minute visit, take 2 of these and call me tomorrow. They're out there. And I want to show that there's a pathway. Now, if you want to jump to the front of the line and work with this, you literally can go to www.medicallyunheard.com. I got that domain because I was sick of people telling me, look, I asked my doctor for advice or suggestions or a protocol, and he just blew me off. Or I asked for my mom, who's 82 years old and isn't tracking with the doctor, and the doctor says, you know, you're not the patient, or I don't have time for you. So we put together resources and articles on literally how to beat your disease. I have a free resource called Hidden Secrets to Curing Your Chronic Disease. I have another book called Hidden Secrets to Daily Living. We have one about how finances and health work together. It's called Wealth Over Health, the decision you can't afford to make. We have a book called Why We Get Sick and What to Do About It. The Smile Advantage of why literally all health starts in your mouth. All of that is something that is just so nice and so there for people that are saying, hey, listen, I'm in the medical system and no one listens to me. I'm trying to help my little girl. I'm trying to help my husband. I'm trying to help myself. You know, one of the things that we hear in healthcare that all the time, especially for women, and I'm not sexist because I'm sure men get this too, is we put women in the middle of this, of a health vortex. And then they're told, give to your family, give to your spouse, give to your church, give to your parents, give to your job, give to your community, give to your school. And if there's anything left, you should give it to you. Well, that's wrong. We shouldn't live that way. What we should do is to say, I need to communicate and take care of the most important person in my life. Because if I'm in full power and I'm listening to myself and I'm communicating with myself and I'm healthy and I have the most important asset in my life, which is how you feel about yourself, then what you can do is you can bless the lives and you can be the leader and be the partner and be the daughter and be the mom and be the husband and be the friend that you're supposed to be so that you can really amplify the reason that God put you on the earth. And that's what I really feel. And that's when I hear people saying, like, no one listens to me. That really strikes at my heart. And I said, I'm going to do a YouTube live on just being heard. So if you're not being heard in the medical system, like, I want to give you a chance to, like, break out. Stop playing in those rules and their confines, because there's clinics, there's systems, and there's doctors that are set up to Look, I don't care about the insurance system because I'm not in the insurance system. My only responsibility is to you as the patient, or it's to your family member that's the patient. So I encourage people, look, become your own researcher. You can get dialed in and ask those questions. Now, one of the things that we did last year that is available if you go to medicallyunheard.com is we have a book called My Family's Healer. And this isn't exactly for the patient. This is for the people that are right next to the patient. This is for someone that's trying to help someone that's been sick for years. This is for that someone that is trying to navigate an aging parent situation or a sick child situation, or literally saying, look, my sister or my brother or my best friend is across the country or in a universe far, far away. How can I help them? And so I put together a program literally called My Family's Healer. And that is what we want to share in Medically Unheard. Look, the most frustrating thing that I see in practice is when people become numbers and not patients. And this is one of the commitments that I do. When people come into the office, we have a little series of questions where we take people that are not, or I want to know different things about them. What's a color you like? What's a food you like? What do you like to drink? What do you like to do for fun? Where do you go on vacation? Where do you want to go? What are you listening to? What are you reading? And what's something that people are surprised to find out about? Because the minute that patient turns into a person, my level of care goes up. That's what we should be teaching all doctors is we need to have people in the system, not patients in the system. When you have that connection with people, you have to hear them. You can't just ignore them. Okay, so what is the purpose of this discussion? Is that you need to stand literally is this. You need to stand up for what you believe in. You need to be empowered in literally something that sets your soul on fire, which is your health. That's your most important asset. My second most important asset is everyone in my family, my wife and my children, their health. And then it just starts to go out from there and there. The way that you do that is you become an advocate. You become educated. Now, do I expect people to be a PharmD? Do I expect them to be a medical researcher? No. But when they come in and they say, hey, did you know that dandelion root is really helpful for the liver? Or, you know what? I read about pomegranates or beets for blood pressure. What do you think about that? One of my favorite things to say is beets are great. And you know what else is really good? The beet leaf greens. The green stuff on top that we all throw away. There's some amazing vitamins and minerals in that. My favorite one is that it helps the blood vessels to be healthy. So if you have hemorrhoids, varicose veins, spider veins, spontaneous nosebleeds, if you brush your teeth and your gums bleed, beet leaf greens. Where did I learn that? From a patient coming in and saying, Dr. West, do you know about the effect of bioflavonoids, rutin factor, and vitamin P on blood vessels? Here I had spent 4 years in undergrad, 4 years in postgrad, a fellowship in clinical nutrition, a fellowship in oriental medicine, written a couple books, and here someone comes in and says, beet leaf greens, that's the most important part of beets. It's so fascinating for me to recognize and to visit with people and to be with people in a space where they're saying, hey, I'm up at 2 o'clock in the morning. I'm looking at PubMed. And now I'm looking at AI. I'm checking out Grok and ChatGPT and Gemini and Perplexity and Claude. And guess what it's telling me? That is what happens when people stop becoming doctors and start becoming guides. And that's our commitment to you. If this resonates with you, go to medicallyunheard.com and literally we can help you get resources so that you're heard inside of the medical system. We have beautiful things. My Family's Healer, Hidden Secrets to Curing Your Chronic Disease, The Smile Advantage, Why We Get Sick and What to Do About It, My Family's Healer. Those are the resources we want to give to people to make a difference. Now, is this going to go out and go viral? Maybe. I mean, it'd be really nice if it did. If you see value and you can help, please like, share, and subscribe. But here's something that I would really literally tell people is this, that we have the opportunity to make a huge difference. And it's the story of the little boy that is walking along the seashore, and he's picking up starfish that had come into the sea or washed up on the shore. And there was a grizzled man telling the little boy, hey, guess what? You can't make a difference. Look at all of these thousands of starfish up here. And instead, the little boy picks up one of the starfish and he throws it in the ocean. And he said, hey, it made a difference to that one. If this resonates with you, check out medicallyunheard.com, get the resources, and stand up for yourself and find a clinic or a doctor that hears you, because this might be the thing that turns your health around. We'll see you guys on the next video.